Angelis.
Okay.
Welcome back, everyone, to another new episode of Grow Your Path to Wellness. Last episode, I was out, but Amanda, she hosted Rachel Dursey. They talked all about, in case you missed that, they talked about financial wellness as a whole, and then specifically broke it down a little bit and talked about how financial stress trickles down and has a direct connection with our mental health. This week we had a cancellation, but Nick Angelis, he was gracious enough to fill in with us this week. So welcome, Nick. Thank you for being here kind of week of last minute.
Thanks for having me.
Nick, we're so glad to have you here. Nick is someone that works just down the road from my office and we have similar mentalities as far as it comes to treatment. So I'm excited to have you on today. Can you share, who are you, what do you do, and why the topics of psychedelics and mental health treatment today?
And I'm the same way. When I've tried to refer patients, I've realized if I say it's down the road, they're like, okay, that's fine. But if instead it's like, well, you really need to go to Cleveland Clinic for this or somewhere that's an hour away, it just doesn't happen. They just nod and smile. So I'm a nurse anesthetist, have been so since 2010. I'm the owner of Ascend Health Center. We say rising above physical and mental pain, where a lot of times patients have depression or they have physical pain, and sort of where those combine is sometimes our sweet spot, because it's difficult to tell, is this fibromyalgia, is this unprocessed trauma. A lot of times it's all of that. So I'm also an author. I do work as a nurse anesthetist in surgery, providing pain relief. So I have a few hobbies. I'm the coach of a soccer team. The Silver Potato Dragons did lose their game yesterday. It was very sad. But yeah. That's
well, the Guardians won to make up for it, at least.
They did. I was celebrating my wife's birthday, and all of a sudden we heard cheering everywhere when we were at Burntwood Tavern. We're like, what just happened? Is it somebody's birthday? This seems very exciting for just bringing out a cupcake with a candle in it. But no, that was when the Guardians won. So
Did you say Silver Potato Dragons? They win best name. Is that what that was?
Yes, and everyone's like, oh, it's so cute that you let the kids decide the name. And then I said, well, actually, I came up with that one.
I love it. I was like, that you win. So. I'm sorry, I realized in your intro, Nick, I didn't say what our topic was. So I'm getting back in the swing of things after taking one episode off. But yeah, guys, we're talking about the use of psychedelics and mental health or wellness treatment. But very cool. So yeah, you guys are neighbors. I mean, there's such cool people around here, and I'm down here in the middle of nowhere. So she's so great and always shares her connections with me. So.
Well, that's true, but where you live, it's at least beautiful. So you can tell someone if you feel bad about your mental health, you can go outside and look at it.
I do. I meet people in my practice. I take advantage of the state parks and the beauty. So we'll walk and kind of do walk and talk stuff. But yes, for sure.
I was just going to say, I am super excited about this topic today because it's like so much more light is on it in the media, in the research world, in the psychology world, like all the email list subscribes that I get for whatever training centers, or, you know what I mean? Like they're all sending me. And then I specifically, because I'm so interested in this topic, signed up on different like psychedelic-assisted therapy type websites. Right. And so I get those emails, and it's just really exciting how much more popular it is becoming. So this one I really wanted to chat about today. Why is this a topic that you're interested in, or what do you know about this, and why that topic today?
Well, I've been a nurse since 2004 as well. So I've been using the drug ketamine in practice for many years. And right now, ketamine is the only legal psychedelic. It's not technically a psychedelic, but for our purposes today, we'll just say, and obviously, as I'm sure you say on all your shows, what we're discussing isn't medical advice where someone should go hunting in their backyard for mushrooms or something after they're inspired by us. Especially because, like anything else in medicine, I mean, there's a lot of hype surrounding it. There's always hype whenever there's any money to be made, for example. The example I usually give is of medical marijuana, where when I started my clinic in 2019, I was like, this is great. We'll work with a lot of medical marijuana places. We'll heal everyone. And then the more patients I saw were like, yeah, I'm really using marijuana. It's really helping my anxiety and depression. The more I realized, no, it's not. In some cases it can be, but it's sort of like the idea of eating chocolate or drinking red wine for your health. It's very difficult to be like, that's exactly the slice of chocolate that I need. little bit less, it's not doing anything for me. A little bit more, it's too much. Here's a slice. And obviously, it's very expensive to find the right tinctures and the right ratios and the right methods of delivery. So some of this is unwarranted hype, where it just companies are excited about making some money. People are selling to the desperate and that sort of thing. And I tend to do a lot of devil's advocate type stuff. But it's also true that this isn't new. LSD had 40,000 patients enrolled in trials from the 50s until 1965. Obviously, ergo, psilocybin, a lot of these substances have been used for millennia. So there's nothing new here. It's simply that even though I've already discussed money, pharmaceutical companies haven't found a way to make the money yet. So of course, there's a lot of negative press. That said, I'm running a blog for a friend who has a website for nurses, and we're seeing more and more patients coming into ERs with issues because they read some of this good press, and our culture today is like, well, surely on WebMD I can figure this out, or surely I can just Google search and then I'll get this all figured out. And you can't really do that easily. The side effects of these are often paranoia, psychosis. These aren't innocent, like, oh, let me just take this substance and I'll feel better. Otherwise, the Prozac and everything that everyone's already tried would have done that. So,
yeah, and I think all of these things that are being used, and I think, do you mind getting into specifics for our community, like for our listeners, as far as what?
Sorry, give the disclaimer, so
No, thank you, because I think it's super important before we get into the specific types, because people are like, oh, I've heard of that. Let me go and Google it, or and it's like, but wait, these are medically supervised, very probably very done in a very specific, monitored, safe way. We're not just telling people to go and look around for it or contact somebody that that is on the street and then just do it on your own. So, but for our listeners, can you kind of break down what psychedelics, like, what are we talking about whenever we are saying that?
So the one that we offer at our clinic, because it's the legal one, is ketamine. It's still a scheduled drug, meaning that if you want a prescription, it's a big ordeal, and it should be. And it's been used in pain management since the Vietnam War. And it was also discovered at that time that it had antidepressant effects, and it helped with PTSD. The way it works is on the NMDA receptor in your brain. There's a substance called glutamate, which is very helpful for your nervous system, but can also cause inflammation. So this helps the glutamate to go in the place where it should. And ketamine is also what we call a dirty drug, meaning it works on a ton of different receptors. And your cannabinoid receptors, serotonin, dopamine. We use it a lot in addiction. It sort of helps your brain to get out of the ruts and the neurotransmitters that constantly feed it, and to try a different way. Of course, that isn't always permanent, and that's where psychotherapy comes in. Because obviously, when you all have clients, you guys have some epiphanies, they come up with these great ideas for the week, and then it kind of fades over time. So this can be similar. That's why it helps to do this in a very specific way, so it's rooted in a permanent, almost quantum shift in your brain, like a salvation experience, and these are spiritual. There's a spiritual component to all these too. Again, that's why it's difficult to quantify medically. So ketamine is the one that's been studied the most. It's the one that's legal. Insurance typically doesn't pay for it. Often at our clinic, we can get insurance to pay for the office visit, so it makes it a little cheaper. But there thankfully is Spravato, which is half of the ketamine molecule that insurance will pay for, as long as you either have suicidal ideation or failed 2 or 3 therapies. And typically the sort of things we're talking about, it's not really for someone who's like, well, I feel a little sad, maybe I'll try this. This is usually you've tried 2 or 3 things, and then you want something that could be life-changing, that could be very potent. So that's the sort of thing.
I was going to ask that, like, what does the research say as far as conditions or diagnoses or symptoms and things that you find? I guess you can speak for your
best practice.
Right.
Yeah,
well,
to be used for.
We do say the kind of hallmark for this, and even in our practice, we do transcranial magnetic stimulation. So the actual diagnosis would be severe recurrent depression without psychotic features. Because if you have psychosis, if you have mania, if you're not really in touch with what the real world is, then something that can cause hallucinations or that can change your mind could make you worse. The latest research is that it's not quite as horrifying as earlier research said, similar to what's been said about mushrooms and LSD, but we're still very careful about who this is good for and who it isn't, because it's not addictive. But we're back to talking about chocolate and wine. Again, if something's helping you and nothing has, the human response is, well, let's do more of this, which, is reasonable.
Nick, this may be a silly question, but is ketamine a naturally occurring substance, or is that a man-made pharmaceutical?
It's a man-made pharmaceutical.
Okay.
There was a research study that they found some substance that some aquatic life made that was exactly the same, but for all intents and purposes, it's not natural. Okay. Now, the way psychedelics work is they trigger a brain-derived neurotropic hormone in your own brain. So it starts, so it's an unnatural process that then starts a natural process. Okay. But that's why there's a lot of hope about these substances, because it's not marijuana or wine or anything that people take to make them feel good until it wears off and then they take more. So, and that's a very important difference between how these are supposed to work.
It's like a spark for the flame.
So it's meant to be a spark. Okay. And in fact, if it's not a spark, if it's an ongoing thing, then at our clinic specifically, we often say, well, let's try something else instead, even if this is maintaining you, the whole point of this. So, and this is a little bit of a tangent. So the philosophy matters a lot. So for example, let's say you're vegan for health and you keep on getting sick. You have to admit, it doesn't matter how strongly I hold this philosophy of health. I'm wrong for my body. Maybe this person's doing great. It's like a diet shake at 3 a.m. It worked for them. So there's a lot with psychedelics where sometimes patients are like, this is exactly what I need. You just say, nope, it wasn't. We have to do something else, no matter how strong we feel it should work. If it's not, we need other ideas. So
yeah, that definitely, Kelsi can probably concur that happens quite often, because there's so much information in the world now, which is fantastic. And still people will show up and say, well, I've basically assessed myself. And I appreciate this so much. Like, I love this. I believe you know yourself more than anyone else. Like, they've seen some things and they're like, oh, I think this is what the problem is. And usually it's more surface level. And by the time we chat some more, there's a lot deeper something going on.
It's a shiny thing. And a lot of times for psychedelics, it's not something where like a free medication sample would do it for you. It does take some sacrifice, either money for the intravenous ketamine or time, because a Spravato nose spray, they have to get a ride home. They just stay at the clinic for 2 hours. And without that sacrifice, it doesn't seem to help either. It's the example I give often is, so I'm dressed up because I'm going to go help out in kids ministry, which is probably hilarious as we're talking about psychedelics at my church. But, like I said, a lot of this doesn't work with, you have to abandon your philosophies and go with what works. So there's missionaries who were giving out this Bible, and they realized that nobody cared if it was free. It was just Americans giving stuff. But if they charged like 2 eggs or half a chicken or some random arbitrary amount, then it was something that people studied and revered, and it meant a lot more. So like, we don't care how much money we're giving, you guys give to us for our ministry. We're not giving out these Bibles for free. It's going to cost people something, and then it's going to do the work that it needs to do. Just like therapy. Like, we know a lot of the BetterHelp type therapies out there don't really work when it's just a quick text and then somebody says something affirming and then you go about your business. It does take a commitment.
Yeah, there's no real work being done.
Right.
I could go on a tangent about that. Okay, so we talked ketamine. What else? I know you mentioned LSD mushrooms. What other?
Right. So there, LSD is it was first studied for addiction when it first came out in the 50s. Ketamine is very useful for addiction, which sounds strange since it helps with pain, but obviously that's why it's useful in particular for opioid addictions. LSD has a lot of promise in addiction. There's also case reports for Lyme disease and for the very complex, no one has an answer for me medical problems. I mean, we see a lot of that too at my clinic, as long as there's a documented depression or something that ketamine's known to help. And often it does clear that up, just because there still are a lot of disorders that we don't have answers for in medical science. So just shifting the brain kind of shifts the brain out of that mode, whether it's post-COVID or from a viral infection, or again, from some trauma that just started a cascade of physical symptoms too. And LSD is known as the one that shifts the brain most radically and most permanently. And then you have psilocybin. A lot of the psilocybin work at Johns Hopkins was about the fear of death in hospice patients. So that is also more permanent than ketamine, which again isn't necessarily good or bad. There's still things such as bad trips. So sometimes the fact that something may wear off over time and you need to continue with therapy is actually a good thing. So that's where that research is headed. And then the one that's probably closest to being legalized is Mdma, or ecstasy. And that's where the group MAPS has done trials with 2 therapists to work on PTSD. So it seems that of all of them, MDMA helps the most with specific traumatic events, while ketamine works with pain, with more severe recurrent depression, and the LSD and psilocybin are more of like change your brain completely type of. And there are a few more like ayahuasca, where that's popular with veterans, where it's a very unpleasant 8-hour long experience, but it kind of helped them get over everything that they saw and experienced and more. So those are the more well-known ones.
Mm-hmm. Have you seen, or like out of those that you kind of listed off, Amanda and I, like, I mean, I can speak for myself, but probably for her as well, we see a lot of individuals with like the complex post-traumatic stress disorder, like some developmental trauma, maybe not trauma, but not single event, or like war veterans, natural disaster
Right.
kind of traumas. Do you see those things being effective for individuals who have like developmental trauma over time in childhood?
Right. So sometimes it's almost like I call it like neuroinflammation, that's a type of depression that these substances work the best for, where yeah, maybe you're supposed to eat the avocado toast to make you feel better, but it's not at a point where just through nutrition you can get better. Now often, and when I first started the clinic, because I have a background in holistic medicine, that's what I'd say: let's get you eating right, let's get you exercising. And now I realize, no, let's not do any of that. Let's get you starting to feel better, and then you'll realize, oh, now it's in my court and I can start doing these things and it's going to be effective. Otherwise, I think if we're like, well, you've tried Wellbutrin and it affects her, let's go with milk thistle or St. John's wort. It's a little bit counterintuitive, and it's a little bit insulting to medical practice as well, because of course, you know, my degree is still in being a nurse anesthetist. I also just went off on a tangent, but hopefully I answered your question.
No, you did. Like, and I love both of us.
I followed it.
We know each other. Yeah, we followed it, and we see you in that, because yeah, like if you're feeling like just your mind and body is so inflamed and you're stuck in like this survival state, you're not in the place where you're going to be thinking critically about your nutrition or your diet, you know, kind of getting something in there to help soothe that inflammation, soothe their nervous system. So
and it's also true, like if we don't know exactly why the trauma is there, the nice thing about ketamine is that we don't have to pinpoint this is pain or this is depression or this is the event, because there's also the stereotype that in therapy it's all about, here's the way my parents failed me, that's why I'm this way. So instead of having to spend weeks and weeks digging down to the root cause, similar how you can take a lot of genetic testing to find out exactly what psychoactive medicine will help you, we can kind of skip a lot of that and just accept it for what it is and see if this helps. So it's more of, let's look at the treatment, and as the treatment progresses, then we can find some clues about the past, but we don't need to be focused on it. Because I'm very big in avoiding the whole sort of daily introspection. In fact, there's probably a better way to say this, but for the Spravato, since it is sometimes a weekly thing for patients, I tell them you'll probably need this or a job, but you may not need both. Like this might be a jump start where then all of a sudden you get busy and you're productive and you don't have as much time to ruminate about the past, and they can just be functional, because really that's what we're looking for. It's not as much like being enlightened and having these epiphanies, and it's just like, well, no, let's just not be on the couch all day. That's all. So.
It reminds me that that kind of like approach reminds me of when I was first starting out in my career, and I helped with like homelessness prevention and rapid rehousing, and we came from a housing first model, right? So a lot of places would make you get sober or make you get a job or whatever the thing, complete your probation, whatever it was, before you could have this housing assistance. And housing first was like, listen, people need their basic needs met. If they don't have a house, they can't get a job. If they don't have a house, they don't have safety to be able to access treatment for whatever their condition is, right? So I love that approach. We talked about therapy, like combining, touched on it a little bit. Anything more in depth, like, patient like experience, obviously HIPAA, but like patient experiences, or what that looks like for someone that's doing medically assisted treatment, basically. Sure. the psychedelics with like mental health treatment.
Right. So ketamine assisted psychotherapy, for a while we had a therapist intern who was doing a lot of that for us, and it was really neat seeing like when it could work and when, again, like I said, it was hype. So normally what we do, because we do have therapists at our office, is within the next few days, we just have them kind of process the event with a therapist. And it's a little bit simpler because, again, we try really hard not to get into the very, like, this is exactly how we have to do it. And these are all the steps that you need. And if you don't do it this way, because then all of a sudden someone has to take a day off work because this is a special day that they have to do the thing. Because we do have a lot of Medicaid patients, a lot of addiction patients, but then on the other end, we also have a lot of CEOs and people who realize that if they suddenly got on Zoloft, it might affect their performance. So it's kind of a dual practice that way. But the ketamine infusions themselves, a lot of places do have therapists during. It's a little bit of a waste because a lot of times this is a very intense experience where you're not completely sure who you are, where the universe is. So talking to someone, although it might be comforting, I feel kind of a waste of money. Now with the Spravato, it being a little bit less intense, often during the second hour of treatment, we will have therapy then. And that's been game changing. So obviously it's made by a pharmaceutical company, so they want you to do it every week forever. But we've realized that with therapy, we can get patients to where once a month they'll come in, and it's a nasal spray, and they'll kind of experience it for the first hour, and the second hour they'll talk to a therapist about it, and they'll come back next month. That's really easy. It fits well into their schedules. They're doing a lot better. And it's not that, because when I first started the clinic, it was more like, you're great, come call us if you need us, because I did want to empower patients. But I realized since then that there's a nice balance between, the insurance model where you're seeing somebody all the time and the whole like, just give me a call if you need something. So it has been very powerful. And every patient is a little bit different on how we can tweak that to make it work the best. And there are some patients who refuse to do therapy. In some cases, we just say, well, then you can't have this ketamine. In other cases, we just tell them, well, okay, well, you'll be here a lot because you're not doing the therapy, but that's your choice. It sort of depends on what the situation is.
Yeah, I hear. So it's very, like any modality, very client-centered, but still a very loose, you can provide the recommendation and
right.
Hey, this is what we've seen, in evidence-based or, research-backed kind of model, but.
Sure. And you think I'd say, well, you have to come to our clinic and our specially trained ketamine therapists. But actually, no, like what makes more sense is, for example, for your guys' clients, they would come see me and then they'd video chat with you guys during. Like that personal relationship you already have with a therapist is much more important than any education. A lot of times our therapists have tried to do outside education and then said, well, no, this wasn't practical. This wasn't about fixing the patient like what we focus on. This was just some sort of abstract advice that wasn't really relevant to getting this person better. So.
And you said, this is administered by nasal spray only?
The Spravato is a nasal spray.
And the other one is
IV. The ketamine itself is either injections or intravenous. There are ways that you can give it as a take-home lozenge, but we just do everything inside of our practice in Fairlawn.
All right. I know we're running low on time. I know you have to be out of here in 5 minutes, but I just wanted to, one last bullet point I think would be helpful for our listeners. Sure. Just really quickly is, how can somebody access this treatment? I think I heard you say it's not mostly covered by insurances, but can you just speak on accessibility really quick?
Sure. So the accessibility for the other substances, psilocybin, LSD, Mdma, it's only through research studies. I mean, you could also find it illegally, but again, there's spiritual components to these substances. So a lot of times it's like, oh, I feel my mind expanding and this new spirituality, and I also hope the cops don't come in. So it makes it challenging, and there's tons of memes out there about a triceratops telling you that wasn't a microdose. So it can be very challenging, and especially if because there are about 6 different ketamine clinics in Ohio, and we all talk together, discuss best practices. The prices are pretty similar across the board. So there's really no reason you have to go to that extent, because even though they're different, it's still the same idea, whether it's serotonin or glutamate or whatever receptors we're talking about. So that is one way to do it. Again, it might be paid for by insurance, and because we have several different cutting edge modalities, again, it's much less about the philosophy of here's what we believe as it is like, here's what's affordable, here's what's sustainable. I think it makes a lot of sense, because these again are these kind of hierarching, trending sort of therapies, to make it very simple and very practical. Here's what will help you and why, and how often. So yeah, Ascend Health Center is our website, and Ascend Health Center is also our Facebook and Twitter. So you can, again, there's a lot of Facebook groups about patients who've done these treatments, and it's like anything else you find online. There's 1-star reviews because people's washers made too much noise, so you have to kind of take it with a grain of salt. But
I'll definitely link your website and Instagram and things on there. Just because we have listeners from everywhere. I mean, I know you don't know about necessarily the whole world, but like you said, there's 6 in Ohio. Do you know anything about accessibility like nationwide?
So if you type in Spravato near me, that will show you what treatment centers there are for that, for example. And again, it's not for everyone. It's a bit more of a cookie cutter approach. It is half of the ketamine molecule. But I often say that about supplements too, that, well, why, and this is unique to me, honestly, but why buy this $100 magical supplement if there's like a Walmart brand that you can start with and see if it makes any difference?
Mm-hmm.
The important thing is to have options. Like sometimes these things will really work for patients, and then they're like, well, I don't really know if I want to come back. I have this issue or that issue. I'm like, well, look, put us in your back pocket. We're here if you need it. And that prevents the sort of spiraling or the ups and downs, because they know they won't feel hopeless anymore, because they know there's something that can help if they, it makes them feel empowered. So
thank you so much. I was just going to ask, is there anything else that you wanted to leave with or wrap up with? But what you just said was so beautifully perfect for that. But I don't want to hinder you if there's any last parting words that you might, as far as this topic or anything else that you didn't get to share.
Not really. I think, again, we have to be careful about trends in healthcare, because there's a lot of shiny things out there.
Mm-hmm.
So I think taking a practical approach of like, is this helping me? When will it help me? What are we looking at? And being honest with your providers too. Like, often if I was in that position, I would just talk to my therapist about it, or my psychiatrist, and get their opinion first. It's not something that should be done in isolation, apart from everything else that you're doing for mental health.
Awesome. Well, thank you for filling in, Nick.
Thanks so much.
So everyone listening, ascendhealthcenter.com or Ascend Health Center on Twitter and Instagram. Make sure you go check out Nick. Thank you again. Make sure everyone turns on your notifications, leave us comments. We love feedback. And then next week, I believe this is another TikTok guest. We have Jessica Harrington coming to talk about self-love over stress. So we will see y'all next time. Take care.
Take care, everyone. Bye.
Bye.
Bye.